What makes a good bariatric surgeon? Here's what to look for. Usually it's pretty evident that when you're out looking for a surgeon, you're trying to find somebody who has good technical ability. And that's, I would say, probably going to be one of the top factors involved with do you have a good surgeon or not? Is their technical ability? How do you judge technical ability? It really comes down to experience and outcomes. Things to look for to gauge that would be if they're part of a center of excellence for bariatric surgery, because generally for a surgeon to participate in a center of excellence, their outcomes get monitored and they have to have good outcomes in order to operate at that particular center of excellence. One thing to evaluate would be how well trained they are. That would be where they trained and if they underwent a fellowship in weight loss surgery or bariatric surgery. Usually it's about a 1-year fellowship outside of your standard training for surgery, which is 5 years. In that 1 year focusing on doing bariatric surgery. A lot of times when evaluating a surgeon, you should look at their credentials as well. Credentials would be, are they board certified and are they a fellow of the American Society of Metabolic and Bariatric Surgery? Those are all the letters after their name. And oftentimes they're a fellow of the American College of Surgeons as well. So American College of Surgeons usually is a governing body to provide quality oversight for the surgeons in the United States. That's known as F. And then the American Society of Metabolic and Bariatric Surgery is an organization overlooking bariatric surgery in the United States. And that's the ASMB. And a fellow of that or a member of either of those or both ideally would point to a surgeon who has appropriate credentials to do a good operation. And then once that part has been evaluated, the next step would be to evaluate the overall surgeon themselves and whether they truly care about what they're doing, if they're empathetic to patients and they really have their heart into what they're doing and taking care of patients. Because a lot of what I do as a surgeon is easy because if I care. And as long as you find somebody who forms that bond with you that cares about what they're doing, usually that means they're doing everything in your best interest and you have a good outcome ahead of you. And I think that's sometimes a harder thing to find, or sometimes it's harder for surgeons to show that they truly care about that patient and what they're doing. It's just based on the personality that sometimes surgeons have. So I would say experience, outcomes, empathy, and compassion. And compassion meaning that you're compassionate for what the patient's going through and that you're sensitive to their needs and what they're going to be experiencing before and after surgery, and you're involved with their recovery after surgery. If you want to hear more information about topics like this, please subscribe to my channel.